Welcome to the Foot Health Facts Podcast, powered by the American College of Foot and Ankle Surgeons. I'm your host and a fellow of the college, Dr. Matthew Dairman. Welcome back to part 2 of our Achilles Tendon series. I'm here again with our favorite bingo-playing foot and ankle surgeon, Dr. Ashleigh Medda. And today we're tackling a big one: what actually works when it comes to treating Achilles tendinopathy. So, Ashleigh, someone walks in with pain at the back of their ankle. What's your first move?
Well, first of all, it's just getting their full story. Like we ask questions: when did the pain start? Was it sudden or gradual? And what makes it better or worse? That really helps us to nail down what's going on. After we move through those questions, I do a physical exam to check for things like swelling and tenderness, stiffness, and your calf strength. What we're really trying to do is rule out a rupture first, and especially if there was like a tendon pop or anything like that. But for most people, especially in my practice, it's a case of tendinopathy. And from there, we try to figure out what stage their tendinopathy is, whether it's acute or chronic, because that really helps us to guide their treatment options.
So let's talk therapies. What actually works and what's more hype than help?
Great question. The therapies that actually work really are just surprisingly basic. So, things like eccentric or heavy, slow resistance stretches and exercises are the gold standard. They really help your tendon to remodel and regain the load tolerance. And load management is huge. So, what I mean by load management is really finding the right balance between rest and activity level, too. And we can't forget about calf stretching and even sometimes manual therapy like massage, which really can help, especially early on. What's more of a hype is things like ultrasound or laser, which sometimes are maybe overpromised. PRP injections have mixed evidence. Some studies show that there are benefits, others show that there's not too many benefits. And while shockwave therapy can help in some cases, it certainly isn't the first line treatment for everyone. Bottom line is there's no magic fix, and tendons heal really through consistent loading and giving it some time.
I think some of these therapies people hear about either from their friends. I don't see them advertised like some other things that are out there now.
Mhm.
But certainly it's kind of like patients come in asking sometimes, oh, do you offer this or that? There's, I think, a place for it in certain things. So how do you use physical therapy? When do you prescribe it and what should it focus on?
Yeah, for me, it's a cornerstone of the treatment for Achilles tendon problems. And I typically recommend starting early, especially if the pain's been going on for more than 2 to 3 weeks. And a good PT program will focus on progressive loading. So that means starting with those eccentric stretches I mentioned before, focusing on your biomechanics, which would be correcting things like poor ankle mobility, your weak hips or gait issues. So, even thinking about things higher than like your foot and ankle, and really focusing on education so people can really understand what's safe and what's not safe during the recovery. Frequency, it really depends on the severity of a person's problem, but once or twice a week with a solid home program works for most people.
So how about heel lifts, braces, taping? Are they worth trying or is that just temporary relief?
Yeah, they certainly can help, but they're not always necessary. Heel lifts definitely reduce the strain on the tendon, which can also ease their symptoms, but they're really not a long term solution, as over time they actually lead to tendon shortening, which can become a problem. And we sometimes utilize braces or boots in more severe cases to initially reduce inflammation, which will reduce pain. But ultimately, our rehab programs focus on getting the tendon moving and being active. And taping, I don't think is a really bad. I think it's actually a good idea, but it really just gives you short term relief, and it doesn't fix the root cause of everything. So I think of these as tools that can kind of augment physical therapy.
Yeah, I use taping more to assess how they're going to respond to better support, whether it's an over-the-counter insert or a custom functional orthotic, something like that. Yeah, there's 3 things I tell patients for Achilles tendon that we need to do. Same thing with when we're treating heel pain. You have to reduce the inflammation, you have to support the arch, you have to stretch everything out. And you have to do all of those things. And that's for the most of the things that we treat as foot and ankle surgeons to try to avoid surgery.
Right.
And if we get all of those things down and it still doesn't respond, that's when we have to worry. So at what point do you pivot away from conservative care and consider something else?
I think if someone's been doing this structured rehab, and I like the 3 things that you spoke about, those are the exact same 3 things that I tell my patients too. But if they've been doing this rehab and focusing on those 3 goals for the last, like, 3 to 6 months with little to no improvement, and, they just address things like their flexibility and their biomechanics, then it's definitely time to consider other options, which does include surgery. But to be honest, like the good news is that people do really well with conservative treatment when it's done early, and most patients don't have to go on for surgical intervention.
Absolutely. Yeah. And I find that conservative care, I do use a lot of shockwave therapy in my practice, and not necessarily an endorsement of the College of Foot and Ankle Surgeons, but from personal experience, I think it's quite helpful in trying to avoid surgery. And a lot of practices don't necessarily offer it. So we find that some people go to surgery sooner because they don't have access to the modality that could potentially alleviate it. It's not a panacea. It doesn't work for everybody, but obviously it's worth trying if you have access to it, in my opinion. So, to end our series on the Achilles tendon, we'll be chatting about the surgical management of Achilles tendinopathy up next. Thank you, Dr. Medda, again for joining us.
Thank you for having me.
You've been listening to the Foot Health Facts Podcast. For more information on today's topic or any foot and ankle concern, head over to foothealthfacts.org. On behalf of the college, I'm Dr. Matthew Dairman. Thanks for joining us today. If you enjoyed this episode, don't forget to like, subscribe, and share it with someone you care about. Together, we'll keep everyone moving forward one step and one topic at a time.